Right then, so I'm going to take an opportunity to do something slightly different today, guys. This video is unedited, and I'm just going to talk over it. So I've had a lot of requests asking what a normal chiropractic treatment would look like. There are a few on my page already, but I thought I could annotate over this because this is a treatment of me. This is one of my treatments from last week by one of our chiropractors, Maddie. I had a particularly nasty flare up of my back last week. The history for myself, I'm 37 coming up next birthday. I injured my back very badly when I was 17 or just turned 18. Having never had back pain at all for the first 18 years of my life, to prolapsing my bottom disc in my back, L5S1, with fragments of that then actually leaking out into the space around my nerve, meant I had real rough time for a couple of years. So I know exactly what it's like to have back pain. I've suffered with it a lot over the years, and although now I am largely absolutely fine and I live a normal, full, proper life, I do still suffer from time to time. Anyway, I digress. Last week, my back did spasm. It was bad. So I have these episodes, and some of them are not that high in intensity but last a long time. Some of them are really high in intensity and don't last long, and a mix of the two. But last week, it wasn't good. It went on me. I had low back pain on the left-hand side, a little bit down into my glute, but luckily no leg pain this time. So back to the treatment. Maddie has lowered the bench. So as you can see, my hips and bum are higher than my feet and shoulders. That's done on purpose. What that does from a chiropractor's and patient's point of view is it just opens up a little bit of space in the low back, and it's a lovely feeling as the patient because there isn't as much pressure or tension on the low back. People will debate what it actually does. In my view, when you're in flexion, which this machine does to you, the bench is in a flex position, it physically will open up the joints and give a little bit more room for nerve roots as well. Either way, what it does isn't really important. It feels really good for me personally, and I would say 8 out of 10 patients that I treat with similar complaints really like this position. So Maddie does this while she's working on my musculatures. On the musculature front, Maddie's treated me probably literally hundreds of times over the last 10 years, so she knows my back really well, which is a big plus. And that's what you do get when you see anyone. It doesn't have to be a chiropractor, it could be any physical therapist regularly. They do know you, they know how you move, they know how your body feels, they know what you like, what you don't like, and they know what you respond to. So it is really good if you have a good relationship and a long relationship with a therapist. So I definitely have that with Maddie. She works a lot on my QLs and my lumbar erector spine in this clip. They particularly tighten up. I know it's getting a little bit technical in terms of what muscles, but they really do tighten up with me, and I have a lot of distortion in my posture this time. I don't always get that, but this time I was significantly off to one side. So the pain was on my low left-hand side of my back, and I was veering off to the right-hand side and forward, which is called an antalgic posture. Your body does that to you to try and avoid putting pressure on the structures that are giving you pain. It's quite frustrating because you literally cannot stand up, and I was in that boat where I didn't look particularly good from the outside. And even when the pain started recovering, I was still looking very visibly in discomfort. But back to the muscles, Maddie's doing, again, the right-hand side now, and she's moving on to a little bit of traction. So the base of your back, right down by the sacrum, she's just stretching apart. So that's giving an extra little bit of give into the spine. Not using a lot of pressure. That can sometimes be a little bit twingy for my back, but it really does feel, even though she's not doing a huge amount to the naked eye, that feels so, so nice. Just that couple of mil of stretch really does take the pressure off the bit that's hurting. And that's the problem with low back pain, is it just feels so constant. But this particularly really does feel very nice for me. So we're moving on to a procedure now called Flexion distraction. So we have new benches, actually. They've only been with us a month or so, which will do the flexion distraction for you. So we're very spoilt as chiropractors now. and the patients are also spoiled too. So as you will see, Maddie's nowhere to be seen, but the bench is moving up and down. So I'm positioned as such, with the opening of the bench being at the exact correct position, that when it does depress down, it is tractioning my pelvis and the low part of my back downwards in relation to the upper bit. It feels really nice. It's quite a pleasant, relieving sensation from the patient's point of view, or from my point of view in this instance. Not everybody likes it, but I would say the vast majority of people suffering with low back pain, discal pain, sciatica will appreciate this maneuver. Now, Maddie's done it so that the bench, when it goes back up, doesn't go too far. So my back isn't ever put into extension. And that's quite a key thing I should mention. It's never going so far that my back feels like it's jamming, because that can be extremely painful and is indeed a motion you wouldn't want someone suffering with disc pain, or especially a disc bulge. As you can see, Maddie's just checking in with me there, so the volume's muted on the video so I can talk over it, but she's basically saying, how's that feeling at the bottom, how's that feeling at the top? And that's something, again, the chiropractors would do with our patients, is checking how things are feeling. Is that feeling good? Could I go a little bit further? Is the pace right? And that's basically what Maddie's checking in with me here. So we're talking about how that's feeling for my back, and it was feeling nice. When it gets to the bottom there, it certainly feels very relieving, especially after having pain for such a long time, and even like a day or two when it's hurting. It really does feel like it's getting on top of you. So flexion traction is great. So now we're moving into some adjustments of my spine. I was really looking forward to these today. I was feeling very stiff and tight in all areas, of course, because of the low back issue, but generally from top to toe, I wasn't feeling good. Now, Maddie's adjusting my middle back, my thoracic spine, and you'll see her put in some fairly, what you'd perceive as mild force through my back. Now, as I said, Maddie's treated me a lot over the years, so she knows my back inside out. My middle back in particular does not respond well to a lot of heavy thrusting. It just doesn't release, it tightens up. So the more prolonged, gentle approach here that Maddie's using just is perfect for my back, and the joints released exactly like we wanted them to. Got exactly the desired result, without all that muscle tension and guarding. So for me, with the middle back, more gentle is definitely the way to go. And there we go, look, getting up, still feeling a bit sore. So this point, we go to adjust the left-hand side. But we had a little bit of a chat, how my back was feeling, and I fed back to Maddie, and we decided not to adjust the left-hand side, which is where the pain was. We had done some treatment the day before, so Maddie had something to compare it to today and yesterday. And between us, we decided, mainly led by Maddie actually, how it was feeling, we decided just to adjust the right-hand side. So this is called a side posture, and to be fair, with the setup, the preparation is key with adjusting. To be honest, my back released very quickly before Maddie even really thrusted it, but we still put a stretch to get the joints to move as we wanted. So that was a really nice release there. It was exactly what I needed, and felt instantly better, actually. Notice I'm sitting with my knees bent here when I'm having my neck adjusted. That takes some pressure off the low back as well. And it's a position I'd advise anyone suffering low back pain, or especially discal issues and sciatica, to adopt even in bed or laying down, as it does actually ease a lot of pressure on the back. So Maddie's going to adjust my neck now. There's the left-hand side. And then she's going to adjust, I think, 2 or 3 joints lower, right down to my sort of junction between my neck and my upper back then on the right. Beautiful, really nice. My neck was tight. I'm holding myself in a really strange posture because my back's bad, and that is affecting my upper back and neck as well. So they've most certainly needed some attention, and I was very happy to receive that attention. So this is coming towards the end of my treatment now. Just some more trigger points of my neck. Maddie was saying that right at the top of my left-hand side was extremely tight and tender, which again does make sense. It was the left-hand side of my low back. Sometimes we see that, sometimes we don't. Doesn't really matter why it was like it just was. So it needed some attention. So right underneath my skull there, Maddie's doing some work. Treatment over. I left this bit in just to show you. I was pretty sore, so that's the best way I could get up without hurting my back. Not the most graceful, hardly a ballerina, but it worked.